Hi, my name is Jose Faz, and this is my project for the capstone experience, predicting nursing staffing through COVID-19 pandemic spikes. There are 6 elements in my document. The first one is background and purpose. Then we're going to have literature review, methodology, findings, discussion, and then conclusion. So the first element is background and purpose. The virus that causes the novel coronavirus, COVID-19, is called SARS-CoV-2, and it mutates quickly, resulting in new variations at a faster rate than the previously known coronavirus. The COVID-19 pandemic is disrupting all the healthcare system, especially regarding the personnel, hospitals, hospital beds, pharmaceuticals, and medical devices during the previous 2 years. Lasseter stated that nurse staffing was already difficult before the COVID-19 pandemic, but with COVID-19 in the picture and the rise of COVID-related hospitalizations, managing the increasingly high demand of staff in hospitals with registered nurses became more difficult. The project's immediate purpose is to establish if there is a link between new instances of COVID-19 and increasing hospitalizations or healthcare demand, particularly among nurse practitioners. Determining whether there is a link between COVID instances and hospitalizations will enable the development of models for forecasting the period between the introduction of the novel variation and the point at which more nurses are needed to provide care in staffed hospital beds. There are 3 main elements in the item or this research, which are the research questions, hypothesis, and data understanding. In the case of a new wave of COVID cases because of a new variant, there are 2 critical points that a hospital needs to be aware of. The point where the capacity is empty and his capacity is full when cases start to increase in a new COVID variant, to the point where COVID-related hospitalizations are significant, is one of the most critical business questions of this case, as it will allow answering the other business questions. The number of nurse practitioners required to provide care to COVID-19 patients without exceeding something that could be considered normal, as a maximum of working hours per week, is critical to planning working schedules and other resources that could be needed in the hospital, such as PPE or extra temporary personnel. In this document we have 2 hypotheses. The null hypothesis that says that the increase of COVID-19 cases does not affect the working hours of the nurse practitioners, and the alternative hypothesis, which says that the increase of COVID-19 cases affects the working hours of the nurse practitioners. For data understanding, in this stage I use datasets that come from the CDC, because it's a government organization that collects data from the different hospitals and stores them in CVS files. Notably, when I stock up all the files, they gave me nearly 26 million observations, and there are a number of variables that keep changing over time, but 48 of them were consistent since the beginning of the time when they started to collect the datasets. So that's what I use for the main core of this study. As we can see, the dataset is massive in size and in amount of variables it presents. So just to have an idea of the type of data we have into those variables, most of them are numeric, and only the categorical ones are treated as categorical because they have some string variables inside. Figure number 1 shows the emergency department visits by hospital subtype, and we can see that the short-term cases are the ones that are more prevalent. Another example of the type of information we have in this dataset is, for example, the chart given in figure 2, where we can see the visits to the emergency department due to COVID-19, and we can appreciate that the short-term hospital subtype are the cases where most of the visits are. For my study, I took a subset for the North Texas area, which is a little bit over 1.5 million observations, and 55 variables, including the dummy variables that I created to be able to manipulate data in that subset, and that's what I'm going to use in my study. To supplement my research, some of the documents I listed in my paper are based on the literature review. 3 subjects are in the literature review: pre-pandemic nurse staffing conditions, COVID-19 pandemic and effects on nurse staffing conditions, and current models to predict COVID-19 variants. The nurse staff sector is complicated, and it was complicated before the COVID pandemic. The healthcare working conditions are heavily influenced by the education, the working conditions each of the hospitals provides, the compensation, and non-wage benefits. Also, according to GRIFS, by 2025 there will be a massive shortage of nurse staff. In the COVID-19 pandemic and effects on nurse staffing conditions, we can see that the team leaders in the hospitals decided to implement systems to expand the capacity of the medical centers. Mobile medical units were improvised in areas with greater demand to increase capacity, as was the case in the pandemic's peak. Many nurses were happy with the experience, as their job was featured in the news and mass media, and auxiliary roles such as the pandemic partner position was created to support the nurses caring for COVID-19 infected patients. The pandemic partners are licensed and non-licensed personnel who work with the primary nurse to care for specific patients assigned to a shift. During the outbreak, one of the main difficulties raised by nurse personnel was the shortage of personal protective equipment, or PPE. Also, when nurses were fatigued from providing care to COVID-19 patients and showed signs of burnout, they used a range of coping mechanisms to help them decompress. Some coping strategies were looking for support from friends and religion. The coping mechanisms should always be considered to facilitate nurses' time to re-energize while coping with the job stressors. Also, programs to support the hiring efforts of hospitals, such as the refresher and re-entry, were implemented to help nurses to rejoin the workforce after taking a break from practicing. Currently, there are a good amount of models that predict the COVID variants and the spread of coronavirus. However, the models that are going to help to predict the staffing resources needs are very rarely known. In fact, I couldn't find any reference of them while doing my research. And one of the main causes for that could be that the focus of the studies are more related to the spread of the virus and how the variants are evolving. So first of all, we want to know, why are the new COVID variants? Well, that's mainly because we are studying a virus that spreads fairly quickly because of 2 conditions. One is the mutations the virus might have, and a mutation is defined as a change in a gene's DNA sequence or the synthesis of the different form of the protein, meaning that it's a new arrangement on a molecular level in the DNA for the virus. And a mutation does not necessarily cause a difference in the function of the gene or an alteration in the synthesis of the protein. It just means that it changes. According to Gruber, the impact of the natural selection on the viral evolution is challenging to anticipate. Other conditions of the viruses is transmissibility, which is the capacity of a virus to spread and infect a population. And what we have to understand is that the viruses always mutate and always evolve in nature, so there is not really a way to prevent or to anticipate the way a virus is going to mutate or is going to spread in nature.